I am Donald Godwin. I am proud to serve as the Dean of the College of Pharmacy, and I'm here with Dr. Joe Anderson, who you'll see as the Associate Dean for Professional Education. And he is a PharmD and a pharmacist clinician, which we will talk about today. For session learning objectives, again, define primary care pharmacy practice, describe the knowledge and skills required to be a primary care pharmacist, and provide examples of primary care pharmacists, specifically in New Mexico. Dr. Anderson.
Yeah, thank you. And hello, everyone, virtually. So we're going to describe what is primary care pharmacy practice, and that is provision of direct patient care and medication management services for ambulatory patients. So ambulatory patients mean patients in what we call the ambulatory setting, which is outpatient settings, such as clinics or pharmacies. That's all ambulatory care. And so providing direct patient care in those areas. We're going to talk a little bit more about medication management services and what all that entails. And so pharmacists are definitely part of the primary care healthcare team. And the emphasis over the last, I would say, 5 to 10 years has been on interdisciplinary care, interprofessional care. And study after study, clinical study after study shows that team-based care is always superior to that of standard of care, which oftentimes is not team-based care. So when you're involving all the members of the healthcare team, and pharmacists are a central part of that healthcare team, physicians are as well, PAs, physicians assistants, nurse practitioners, nurses, other providers, social workers, etc. That care is superior to again, standard of care. We also serve as a resource to primary care teams. We are oftentimes practicing in the different specialties in which medicine practices, such as cardiology, infectious disease, psychiatry, etc. And so we are often referred to or consulted with by not only primary care providers, but also specialty care providers. And so what do primary care pharmacists do? And essentially, we provide comprehensive medication management. We're going to talk more specifically about that in a few slides later. But we also promote wellness. Many of you on this webinar have probably received immunizations, I imagine, from a pharmacist. So promoting public health awareness, wellness, prevention, providing healthcare screenings in the pharmacy setting. Of course, we consider ourselves as the medication experts based on our training, which we're going to talk about in just a little bit. But so we are providing drug information to patients, to other providers, providing healthcare professional education. And a big emphasis is on providing patient education and counseling. And not just counseling about medications, but in the setting of screening for healthcare risks. We're providing patient education about the necessary screenings that a patient may have to have to prevent illness, but also educating the patient about the conditions that they have. And in some circumstances, pharmacists, primary care pharmacists participate in research studies and clinical trials of new medications, for example. So where do primary care pharmacists practice? Well, essentially everywhere. And if you think about hospitals, believe it or not, primary care pharmacists are there. And particularly in assisting in what we call patient transitions of care. So transitions of care, when a patient is admitted into a hospital, that's a transition of care. They're coming from home to a hospital, or when vice versa, when they're leaving the hospital or being discharged from the hospital, that's a transition of care. And that's a critical time period, both being admitted into a hospital, but also being discharged with regard to medication therapy. And oftentimes pharmacists head up that process of providing transitions of care for those patients. Of course, we work in ambulatory care clinics, community pharmacies, Also, federally qualified health centers, which are located oftentimes in areas of underserved areas and patients who have substantial need for healthcare. We work in government and uniform services, so places like the Veterans Administration or the Indian Health Service or Public Health Service or all the armed services, Army, Navy, Coast Guard, Marines. We work in home care and long-term care facilities. Long-term care, thinking about nursing homes. We work within managed care organizations, and increasingly we're working within private practices of physicians in that interprofessional care-based concept. And then some of us, like Dean Godwin and myself, work in universities and academic health centers. And so I mentioned earlier, one of the key things that primary care pharmacists do is provide comprehensive medication management. And so what is that? Well, it's first, reviewing the medications that a patient may or may not be on, and determine whether or not that medication that they're receiving is appropriate for the condition they have, appropriate for the dosing is appropriate for that particular patient, and then determining whether or not that therapy is effective. Is it doing what it's supposed to do? And then safety, ensuring the safety of the medication, making sure the patient's not experiencing adverse effects from that medication that may require certain monitoring. And then always checking on adherence. Is the patient actually taking the medication? And if they're not, why not? And trying to work with the patient to improve adherence. Also, part of that is providing chronic disease management. There are many conditions that we consider chronic conditions, such as diabetes or high blood pressure, asthma, heart failure, et cetera. And these are conditions that are largely managed through medication therapy. And oftentimes patients have multiple chronic diseases. So if they have diabetes, oftentimes they have high blood pressure. And so they're on multiple medications. And sometimes these medications can interact with one another. Sometimes they can interact with some of the other conditions that a patient may have. And so primary care pharmacists play a critical role in providing chronic disease management. And lastly, a prescribing authority. In the process of performing medication reviews and providing chronic disease management, pharmacists have the authority to initiate therapy, adjust therapy, or in certain circumstances, even discontinue medications. And this can occur under something called collaborative practice agreements, or it may occur independently in some states. And so I want to talk briefly about collaborative drug therapy management. So collaborative drug therapy management involves a collaborative practice agreement that is established between one or more physicians and a pharmacist, wherein the pharmacist can practice within the context of that collaborative practice agreement or protocol. And so it provides the guidelines for which a pharmacist may provide that drug therapy management. And so it may include what assessments can a pharmacist do, such as physical examinations or ordering laboratory tests or other tests related to drug therapy, or assessment of that patient's condition. It certainly includes collecting patient medical and medication histories. And then it also includes administration of medications. And then, of course, selecting, initiating, monitoring, and adjusting drug therapy regimens as necessary. Next slide.
So what do you guys need to know to be able to be a primary care pharmacist and be able to do all those things that Dr. Anderson was talking about? Well, obviously you need to go to pharmacy school. Pre-pharmacy education, depending on what schools you are looking at, can be anywhere from 2 to 3 years of prerequisites, sometimes a little more than 3 years. Those courses being in biology, chemistry, mathematics, and of course humanities courses as well. Doctor of pharmacy programs are 3 or 4 four-year graduate level programs at which at the end you will graduate with a doctor of pharmacy degree or a PharmD. And again, for more information, you can always visit the American Association of Colleges of Pharmacy website, and they have great information there. So what do you learn in pharmacy school? Well, first of all, you learn a lot about disease pathophysiology. You really need to understand the mechanisms of disease, how those diseases are affecting patients in order to be able to choose the right medications and manage those medications. Of course, once those medications are chosen, you need to understand the pharmacology. You need to understand how those drugs work or their mechanisms of action. You need to understand the side effects, drug-drug interactions, and also contraindications of the drug. You need to be able to understand how the drug behaves in the body. So you need to understand the drug pharmacokinetics and its pharmacodynamics. Pharmacokinetics such as drug absorption, distribution, metabolism, and excretion, also referred to as ADME. And then, of course, you're going to be making those dosing adjustments based on patient-specific factors such as kidney function or weight or liver function. And finally, lots of information to know about clinical therapeutics, and again, how to use those medications to treat those specific conditions, and again, how to dose, and really how to monitor the patient for safety and efficacy. All this knowledge, then the communication skills. Pharmacists have to do a lot of communicating to their patients and to other healthcare professionals. So again, patient counseling, you need to be able to clearly explain complex medical information and medication instructions to patients. You need to be able to work effectively within a healthcare team. You are going to need to learn how to do those patient assessments. You're going to need to learn how to interview the patient to get the information that you need for effective therapy. Assessing their symptoms, performing physical examinations, and again, gathering medical history. Very important is the clinical decision making. You're going to need strong critical thinking and problem solving skills. But you're going to be choosing these medications. You're going to be managing. So you need to be able to make informed decisions about patient care. And again, as Dr. Anderson was saying, in some regions or in some states, pharmacists, you have the authority to prescribe or adjust medications. So all of these skills roll up into something that is called the pharmacist patient care process. And it doesn't matter which pharmacy school you go to, you will be using this pharmacist patient care process, where again, if you start at the top in the yellow box where you're going to be collecting that information, assessing that information, putting together the plan for your patient, implementing that plan, and then of course the follow-up. You're going to be monitoring and evaluating that plan as well. And again, this thing is always going to be occurring. That's why it's sort of a wheel. But you'll also notice that the patient is always at the center of the process, and that's most important because you're doing all this for the patient. After pharmacy school, there are some postgraduate training opportunities, not required, but particularly if you want to do a lot of higher level clinical pharmacy, you can do a residency, either a postgraduate year or PGY1 residency. And then also you can even go into a PGY2 specialty residency. Lots of specialties: infectious disease, pediatrics, oncology, emergency department, lots of different specialty residencies. You can also go into do a fellowship after graduation, which could be more in the pharmaceutical industry or in research. And of course, you can also have different certifications through the Board of Pharmacy Specialties. And then you'll see at the bottom something called the Pharmacist Clinician, which actually that is specific to New Mexico. And I'm going to have Dr. Anderson talk more about Pharmacist Clinician because he is one.
Thank you, Dan. And so here in New Mexico, we actually have two categories of what we call primary care pharmacists. And one is the pharmacist clinician. Dean Godwin mentioned I am a pharmacist clinician. And so that's a pharmacist who has prescriptive authority based on the collaborative practice agreement, which we mentioned earlier, with a supervising physician. So if you think about it, this is an example of interprofessional care. The pharmacist clinician is working with a physician, supervising physician in this instance, and develops a prescriptive authority protocol. That's an agreement between the supervising physician and the pharmacist clinician, and tells the pharmacist clinician, or allows the pharmacist clinician rather, a scope of practice. And so that may be very specific to maybe one condition, may be very broad and just say adult internal medicine, and the pharmacist clinician can manage all the conditions that an adult may have. And so those are very broad and categories within the collaborative practice agreements with regard to prescriptive authority. Then we have pharmacists who have independent prescriptive authority, and independent meaning they don't have a supervising physician in which they're prescribing underneath. And so the independent prescriptive authority are based on protocols that are approved by the Board of Pharmacy as well as our medical board in our state. And so these, in New Mexico, these are the current independent pharmacist prescriptive authorities. And I would point out that all of the students who graduate from the University of New Mexico receive training as well as certification in each one of these areas. And so upon graduation, our graduates, and then licensure, our graduates then can prescribe in any one of these areas. And so immunizations, which most states now allow pharmacist independent prescriptive authority or collaborative practice authority to prescribe and then administer immunizations. In our state, that also includes childhood immunizations all the way through adult immunizations, as well as includes travel medications. For tobacco cessation, pharmacists are allowed to prescribe any FDA-approved tobacco cessation product to aid individuals in quitting smoking. Tuberculosis testing, some of you may have been tested for tuberculosis with the skin testing. Naloxone therapy, which is a reversal agent for opioid toxicity or overdose. Hormonal contraception, post-exposure prophylaxis for HIV. And then our newer protocols are test and treat protocols, meaning the pharmacist first performs an assessment along with a test to determine if somebody has this particular condition, such as strep throat or flu or COVID. And then they have the authority then, if it's positive, to treat those individuals. We have several pending protocols. They're going through the approval process right now for pharmacists to be able to treat uncomplicated urinary tract infections and pre-exposure prophylaxis for HIV. So in New Mexico, what are the requirements to become a independent prescriptive authority pharmacist, or to have independent prescriptive authority rather? Well, first and foremost, these protocols are specific to New Mexico pharmacists, so you have to be licensed in New Mexico as a registered pharmacist. And then you have to complete a Board of Pharmacy approved prescriptive authority certification training course. As I mentioned, all of our students receive that training in our curriculum. And then after you've received that training and are certified, you have to do some continuing professional education to keep those skills current. This is a map demonstrating the number of states that allow pharmacist independent prescriptive authority, and this is growing each and every year. So those states that are shaded in green have independent prescriptive authority, and this does not include vaccines. So these are states that go beyond just vaccinations and allow independent prescriptive authority. Those states shaded in pink allow, as I mentioned earlier, dependent prescriptive authority or collaborative practice agreement prescriptive authority. And with regard to the pharmacist clinician, that's remember the pharmacist that has prescriptive authority based on a collaborative practice agreement. What are the requirements for that? First and foremost, again, licensed as a pharmacist within the state of New Mexico. And then successful completion of a Board of Pharmacy approved 60-hour physical assessment course, and completion after that physical assessment course of a supervised direct patient care clerkship that consists of a minimum of 150 hours and a minimum of 300 patient contacts. Our students are not eligible for the pharmacist clinician upon graduation, but they can get those hours shortly after graduation because they have an opportunity to take the physical assessment course within our curriculum. And then they have additional maintenance of continuing professional education requirements. And then if they are practicing prescriptive authority, they have to submit their prescriptive authority protocol. Remember, that's approved by a supervising physician to the Board of Pharmacy for approval. In terms of this type of primary care pharmacist practice, there are actually 3 other states aside from New Mexico that have that other category or licensure for the pharmacist. North Carolina has it, and they call that particular pharmacist the clinical pharmacist practitioner. Same in Montana, they call it the clinical pharmacist practitioner, and in California, they call it an advanced practice pharmacist. And so there is a question, it looks like, are you aware of pain management fellowships or residencies? Yes, absolutely, there are pain management fellowships that we are aware of. We actually don't have any at our institution or in our state, but there are some fellowships that I'm aware of.
Then the prerequisite.
Yeah, and is there a special prereq for the pain management program? Is that the question?
I think it's the pharmacist clinician.
Oh, no. So the pharmacist clinician prerequisite would only be licensure as a pharmacist and then completing that physical assessment course, and then getting those hours. And those hours have to be accumulated individually by the pharmacist. So they're oftentimes working with physicians or physician assistants or nurse practitioners or even other pharmacist clinicians. Those individuals can all supervise the pharmacist who's getting those 150 hours and 300 patient contacts.
I'll do the pharmacist clinician certification translate.
Oh, that's a great question. Yeah, unfortunately, the pharmacist clinician certification does not translate to other states. In fact, those other 3 states that I mentioned, North Carolina, Montana, and California, all have different requirements for their advanced practice pharmacist. And so right now, as of right now, they don't translate to one another. Unfortunately, we'd like that to happen.
Do the independent pharmacy owner?
How can you, we do have independent pharmacy owners who are also pharmacist clinicians. And so they serve to be really an extension of a primary care provider in a lot of their communities. And so they're doing a lot more than even just the independent prescriptive authority. As a pharmacist clinician, they can manage chronic disease states. And so yes, we do have independent pharmacy owners who also are pharmacist clinicians, but also have the independent prescriptive authority. And many of the independent pharmacists, as well as chain store pharmacists, provide independent prescriptive authority.
So for the next question about an international pharmacist, basically if you're eligible for a licensure in the state of New Mexico, then you would be able to participate in the pharmacist clinician program. Again, you would need to complete the 60-hour physical assessment course and then get the hours, the 150 hours that Dr. Anderson has described.
Yeah, they first have to be licensed as a pharmacist in the U.S. if they haven't already.
That's in New Mexico. So.
In New Mexico, right? But it could be in the U.S.
Oh,
yeah. Because we do have pharmacists who reside outside the state of New Mexico, complete the physical assessment course, either our physical assessment course or an equivalent physical assessment course. get the hours outside of New Mexico as long as it's under either a supervising physician, nurse practitioner, PA, or again, a pharmacist with prescriptive authority. Those hours count towards the pharmacist clinician. And a lot of that information is at the New Mexico Board of Pharmacy website on how to become a pharmacist clinician.
All right. Well, again, thank you very much. We apologize for the slides, but you'll see them. Feel free to reach out